Hey guys, welcome back to the Communicators Podcast. I'm Dave. I'm the Executive Director here at Good Shepherd's Clothes Closet.
And I'm Chaplain Chaz Blackburn, and I have the honor of being the president of Good Shepherd's Clothes Closet. And we have a friend who is in a lot of events in the community that we get to see with access to healthcare, so I will let her introduce herself.
Hello everyone, I'm Jessica Solis with Access to Healthcare Network. I am the outreach coordinator, and I'm here to share a bunch of resources with you guys.
A bunch? Wow.
We love resources.
Hey, you know, that's one of the things we do on the show is we highlight different resources in the area. We have politicians on. We have all sorts of different kinds of people on, and it's all about community, which is why it's called the Communicators Podcast, is because our community really does care.
Mm-hmm. Yeah.
You got anything to add to that, Chaz? Leave me hanging like that?
No, I actually have to send a really important email, so I was trying to hide my phone.
Yeah, I saw that.
I'm not trying to be rude, but no, it's true. It's all about highlighting resources. We have to collaborate, and for those who need our resources, we have to draw awareness to it, especially in the nonprofit community. We want to work together instead of being not working together. I can't even think it's a Monday.
Collaboration, maybe? I don't know. We've only said it a million times.
It has been one of those weeks, and it just started. It's Monday.
Oh my goodness. Oh my goodness. This guy. Anyways, we're going to jump into our sponsorship segment. Our first sponsor we're going to highlight is Shelley's Hardware. Shelley's Hardware, if you need that bolts, or if you need a key made, or if you need a lawnmower, you could get it all at Shelley's Hardware. They really do care about the community, obviously. They sponsor the Communicators Podcast, and you can get everything you need. And they're small, local. I can walk in there if I need a key made, and there's someone at the front counter. And I can actually get the key.
Go figure that, right?
I don't have to wander around Walmart and be like, do they even make keys anymore? I think they do technically. But
they actually have like a machine now.
Right.
You just put the key in and it makes it so you don't have to talk to somebody.
What customer service? Sounds like this is something you've used a couple times.
Actually, I have, yeah.
Well, if you want to talk to a human being instead of a robot, you can go to Shelley's Hardware and get the key made. And they do an excellent job. And I've had the machine type keys before. And guess what, Chaz?
They're not always done well, though.
They're not always done well, and sometimes they don't work.
It's true. It's very true.
And Shelley's Hardware backs their work, and they make sure that key works every time. Every time.
Good customer service.
Good customer service. The next sponsor we're going to highlight is Spherion Staffing. Are you a business in Reno searching for top talent, or an individual looking for your next great career opportunity? Are you looking to leave access to healthcare?
No.
Okay.
Never.
All right. Just in case. Spherion.
Like somebody would say it on live podcast or on the podcast.
Just throw her under the bus.
She does love what she does. She was just talking about before the show that she plans to retire there. That's awesome.
That's beautiful. Awesome. But if you are looking for your great opportunity, your great career opportunity, look no further than Spherion Staffing. As the local experts in recruitment, Spherion understands the unique needs of the Northern Nevada job market. They connect qualified candidates with leading companies, ensuring the right fit every single time. Whether you need administrative support, light industrial staff, or a professional hire, Spherion takes the stress out of staffing. Call or text Spherion today at 775-829-8367.
It's pretty cool you can text somebody for a job.
That is pretty cool. I need a job. I need to get hired.
You don't even have to talk to somebody.
Crazy. Oh my gosh. This guy. You know, I'm so happy. I was so happy when the announcement happened with Walmart. They were going to take away the self-checkouts.
Oh.
A lot of the self-checkouts are going away. Not all of them, but a lot of them. Because people were getting away with stealing a bunch of stuff.
Yeah.
Mess it up for all of them.
Crazy thought. Having a cashier is better. and
Go figure.
It is. I think it's way better. But for shut-ins like you, Chaz, you can still do Walmart delivery.
No, thank you so much.
So you don't have
the membership fee's too much. I checked it out. Actually, you know what? I love going around the grocery store. Like after I go respond like a bad death or something, I like to go walk around the grocery store and just like zone out and process. And what a blessing to be able to pick out food. And
Oh yeah.
I don't know. It's relaxing to me. Other people are like, you're crazy.
My mom agrees with you.
Yeah.
She goes there for everything. She's like, I'm stressed. I'm going to the store.
Yeah, it feels good.
Oh, there you go. All right, so those are our sponsors. Thank you so much. We are here at Good Shepherd's Clothes Closet. We're a small local nonprofit, and this is the Communicares podcast here in Good Shepherd's Clothes Closet. If you want to learn more about Good Shepherds, go to getclothes.org. All right, Jessica, thank you so much for being here. We really appreciate it. What have you guys been up to? What's kind of the new updated things with access to healthcare?
Well, I'm happy to announce that we have been 20 years and going,
Wow.
still going, super strong. But it was our anniversary this year. Woo! 20 years.
Congratulations.
Guess what, guys?
What?
We also won Best Place to Work for the third year in a
Wow.
row. Woo!
Are you guys hiring? For Dave. I was just kidding.
Jeez.
Oh, just kidding.
So I'm really happy, honestly, to share this information with you guys because it just kind of tells you that we're here. We're not going away. For anybody that has ever doubted us or that has been feared of, they're not going to be there forever. I remember when I actually wanted to switch over to access to healthcare, but a lot of people were like, no, don't. It's a nonprofit. You're not secured a job. And I'm like, ah. But no, that's not it.
Well, I didn't realize that. So are you considered an MCO?
No, we are not
Okay,
yet.
but a nonprofit. That's awesome.
Nonprofit organization, but
They're
we
like
do
the funnel.
Yeah, okay.
Yeah, we're actually the people that get in the situation of they don't qualify for Medicaid anymore, or whatever the case might be. We're the in between the cracks kind of
Okay.
deal
Awesome.
for some of the services, of course. So that's kind of the new stuff. I want to kind of go over the flyers and just kind of show them to the people and everything. Our main flyer, one of the main flyers is our resource flyer that just basically outlines everything that we do at Access to Healthcare. So in terms of our Nevada Care Connection can help with food stamp applications, Medicaid applications. We also do anything Medicare related. The state pays us to help with anything Medicare. We do the Women's Health Connection, so breast and cervical care for free for women that are low income, the transportation program, and then the discount program. So that kind of just highlights a little bit of that. But going into our discount program flyer specifically, we have our medical, dental, and vision, and then we also have our just dental and vision plan. The medical, dental, vision works for anybody that wants to retire early and just doesn't have any other option. They don't want to go pick a private insurance for the meantime. It is $45 or $50 per month. We do have a senior section one that would be about $60 per month, and it is medical, dental, and vision, like I mentioned. So it is a discounted rate. But those individuals who are on Medicare already, but they don't have a dental, they don't have Medicaid, so they don't have like a dental insurance. They can do the dental and vision plan, which then with their Medicare stipend, they can go ahead and pay for a discounted rate prices rather than self-pay rate prices.
That's pretty cool.
Yeah.
So I want to get, you've been working with Access to Healthcare for a while.
My glasses
So,
are crooked, you guys.
I'm
just
sure-
gonna take them off.
I'm sure you know
I love throwing you off.
I'm sure you know all sorts of stuff about the history, how it started. Can you share a little bit with our audience some of the history of Access to Healthcare and why it started?
Yeah, I mean, I don't want to say, like I know everything about it, but I do know that it was definitely a kind of a written plan. Sherry Rice was the one who said, you know what, we have so many uninsured, underinsured individuals who just simply don't qualify. So why don't we do some sort of discount where we are not, I don't know if these are her words exactly, but this is what I like to tell the community, where we are not bound by the rules of you have to have a social security number. Or you have to provide all this other information to be able to qualify. So again, we are helping those individuals who have basically no other option. It started, 20 years ago. It started with a discount program only. And then from there, we started adopting others. So what we wanted to do was we want to be a stop shop for everything. So if you are coming to the discount program, we understand that maybe there is a need for transportation. There is also maybe a need for those women who can maybe not even pay for a mammogram. Well, we adopted our Women's Health Connection program so that we can also serve those individuals who are, okay, well, I can pay the discounted rate for other stuff, but I can't really pay for some of the discounted rate prices even. So we also adopted our Ryan White program to help anybody out there with an HIV diagnosis with their medication. The Nevada Care Connection was big when it came in. That is the one that helps you with any sort of application that is an assistance-based need, right? So housing, electricity, medication, that whole Medicaid and food stamps application. A nutrition program came in. What we started seeing is that, well, obviously everybody wants to stay in shape. Everybody wants to prolong their lives. So why not add a nutrition program where we can also help a little bit with the preventative care, right?
Which can save lives.
Yeah.
I mean, we take those for granted. At least I'm speaking for myself. You know, those checkups, they can save your life.
Your mom told me you're using the air fryer.
Good.
They throw me off. So okay, so, I know
That's
this
healthy.
is a side note.
Healthier.
It's healthier.
Yeah.
And side note, I was like,
why.
I don't
See,
like
it's
fried
connected.
food.
Thank you.
And Dave was like, dude, you gotta try this. I'm like, it's not that good. My mom bought me one. Or
Years
she gave
ago.
me one years ago. I
Years
just
ago.
tried it. I'm using it for everything.
I know, I told
shrimp,
you, dude.
scallops, like just steaks,
Dude,
asparagus,
Yeah.
mushrooms. I was like, whoa. So you're right. How's that?
I'm always
Feel
right.
good?
So,
You know what? You could also use it if you don't want to turn your whole oven on and you
Yeah.
just want to heat something real quick. Boom.
Yeah.
oh,
Pizza,
you,
like
oh, you
leftover
put
pizza. in
leftover
there?
pizza. Not
Yeah.
that it's healthy, but
I actually
leftover-
haven't, but I've been told it's good.
my two favorite things to put in my air fryer is leftover Costco pizza.
Yeah.
And the other thing is the little Kirkland brand
Egg whites.
egg
I heard
whites.
that.
Oh, yeah.
egg white bites.
Yeah.
So good. You just pop them in. Just so you know, okay, this is now a cooking show. 400 degrees for 13 minutes.
I'm going to take some notes.
Perfect.
Oh,
So good. And they're like crunchy and they're soft on the inside. Put a little hot sauce on. So
Wow. I thought you were vegetarian.
I am vegetarian.
You eat eggs?
well, that would be a vegan, remember?
Oh, I thought you were vegan.
Remember?
Hey, remember? Remember the other conversation we had?
She's been teaching you
Yeah.
which is which. That's great. Sorry, Jessica, to throw it off the rails like
I
that.
don't know. All joking aside, though, it really is important to save lives, and those are things. Everybody deserves dignity, right?
Yeah.
Whether that's healthcare or dying with dignity, everybody deserves to. No, seriously, because we talk about this. At the hospice house, some people cannot qualify for even insurance or hospice, and they die in pain and agony. And so we serve all. We serve those who may be an immigrant, undocumented immigrant. Everybody deserves that. It doesn't matter where you're from, who you are.
Yeah.
And same thing with the clothes that we provide here. Everybody deserves to be clothed with dignity.
Yeah.
And same with healthcare.
Well, especially with things that are like thrown away. And clothing's thrown away a lot.
Yeah.
So it's like that. There's no reason people that need it.
Well, even the
shouldn't
things
get
that cost money, people deserve dignity. Well,
I don't know. Deserve dignity. That's a loaded term. What's deserved, Jazz?
I'm not talking like entitlement. I'm talking like respect for your fellow human being, no matter their views.
Okay.
see
All right.
that.
Well, we'll dive into it more later. Don't worry. Off the cameras.
Just like when I come on a show again
Oh,
for.
I remember you guys. You guys are actually more talkative now than the last time I was here. So.
Well, we learned more. I mean, now it's been 2.5 years.
What episode number will this potentially
I don't know.
be? You know?
I don't know.
Like
off the top of my head.
we're over 3 years.
It's got to be like 150 or something. I don't know.
Yeah.
150 times with you almost.
Yep.
Wow.
I don't know, man. There's been a couple guests though that you miss. We've had them on a couple times, and you miss them every time.
Oh.
Dude, I
there-
saw Dr. Rue.
Yeah.
I
Yes.
saw him. He's not Dr. Rue, but the EMT that works for Dr. Rue.
Cameron.
I saw him,
Yeah.
Cameron at the senior fair. Were you there?
Yeah. Well, my coworker is.
One of your coworkers? Yeah, I saw him there. I was like, dude, by the way, it's not that I don't like you. Every time you're going to be on the show, there's like an emergency. So I'm so
Just
sorry.
saying. Oh yeah, emergency chat. Sure thing. Jessica.
Back to the zone.
As far as future and vision goes for access to healthcare, what are some things, initiatives maybe you guys are trying to do, or things you're just introducing?
We are trying to actually partner. Well, we're trying to see how it goes with our transportation program. So currently, we have our free transportation for the elder and disabled, but we also have our new flyer for our paid for trips. Now, this is anybody who's not in the qualification of disabled or elder. They can call us up. We can do a trip. It is 60 one way, 120 round trip to basically anyone. You can go to your friend's house. We don't have any limits because you're paying for the service. So what we're trying to do is seeing if maybe insurance companies, so anybody out there listening, we're always welcome to hear any propositions and go from there. If insurance companies wanted to, basically have a service for their individuals, right, their members. We know that a lot of insurance companies already have a little stipend for their members. Hey, here's some money for transportation. So can we make sure that we, let's say, are part of that? Yeah. So instead of here's for the Uber or whatever, pay us that money, and then we can go ahead and serve your members in that way. So
the unlimited part, that's really cool.
Yeah.
So that's different because in Uber, you get that one ride for that member, right?
Yeah.
And then that's $10, $20 maybe.
Yeah.
But with you guys, it would be. And the other thing about that is no tipping. That'd be nice.
Yeah, no, honestly. And so a lady just asked me that. She's like, do you guys accept tip? And we say, look, we don't encourage it. We don't advertise it. Right. There's a couple of individuals that are, here's a box of cookies. We don't tell the drivers, well, you can't have the cookies. But the drivers don't ask for any tips, nothing like that. So it's not something that we're looking forward. They get paid really good.
Cookies.
So they're not.
Those Girl Scout cookies are good. Like, give me a box of those, I'm happy.
That's a great tip.
Great tip. Yeah.
Put them in the air fryer. Just kidding.
Oh, you know what? That might not be bad for the coconut ones.
Yes.
Man, those are great.
Hey, guys, stop.
I do not like the coconut ones.
No?
You don't like coconut?
I like coconut.
I like it.
I just feel like it just doesn't work, man. But honestly, I'm not a big sweets person in general.
Okay, well, that makes sense.
Oh, that
makes sense.
Makes a lot of sense.
Not very sweet. What can you say?
Oh, no. Yeah.
So
that's one of them.
Yeah.
Actually, maybe that is all of them.
So I saw something on Facebook before my Facebook got hacked, and it looked really exciting. You're laughing over there. But you guys have a new kitchen you're probably going to talk about, or the fridges.
Yes.
It's amazing.
Yes.
Tell us about that.
So we actually do have a food pantry. It is client-based, so that's really important to just kind of note out there for anybody listening. It is client-based, meaning you have to be part of one of our programs to be able to access that pantry. But we partner with the Northern Nevada Food Bank, or Food Bank of Northern Nevada. And so what we do is that we actually come right across the street from you guys. We pick up the donated food. We take it back to our pantry, and we're able to serve the community that way. We do have a partnership with a couple of organizations where it would be basically money for us to be able to purchase other goods, because sometimes the Northern Nevada Food Bank has limited. So we do have other products aside from what the Northern Nevada Food Bank donates to us. Awesome. But yeah, it's a client-based food pantry, and I am happy to say that I'm basically the one running it.
Awesome.
And I love it. So yeah,
well,
that is
congratulations. I mean, that is a wonderful additional benefit for your members and for the community. So
yeah. We are wanting to, but we don't know if this is going to happen. We are partnering with other organizations, other nonprofit organizations that are maybe having a little bit of a hard time, keeping going. So maybe sooner than later we can introduce other organizations. We're hoping maybe primary care. We're hoping maybe mental health services. We don't know just yet how that's looking, but yeah, we're in the talks, and we'll see what comes out of it.
Well, all your benefits are a blessing to the community. I mean, anything is better than nothing. And I'm really just grateful that you guys are out there and carrying the torch for 20 years. That's awesome.
Yeah. Woo.
why don't you tell us more about you personally? What is your life like? What do you do? Do you go for runs? Do you sword fight? Do you have a dog? I don't know.
Is there a story there? A sword fight? Like,
Are you challenging?
who
me to a
says a
duel?
story? Oh, the Star Wars thing. Yeah.
What?
The
What?
Force is not with you.
Do you know that Abraham Lincoln, he wouldn't do a duel, but someone called him out.
Oh.
And so he did the duel. And he won.
Wow.
So
That's awesome.
And after that, he said he'd never do a duel again. And he never did.
Good. Well, sometimes you got to put your mind into it, and that's it. Which is
Crazy.
my
So the other swordsman missed his shot.
I think it was a gun duel. I think it was a gun duel.
got it.
And it was a shot.
That's bad matchup.
Oh no. My brain caught up, man. That was not okay.
You turned it on red.
Well, a little bit about me. Back to,
job.
to me.
Good job.
Yeah.
I do love dancing. It is a passion. It's in my veins. It's in my heart and everything. So I do go out dancing every now and then. Just like maybe once or twice every 2 months, every 3 months. I don't have any pets, but I do have 2 kids, 15 and 12, and I'm married. My husband and I are together, and, beautiful home. We have our home over in the set area. So I came a long way to come here with you guys.
Especially in that traffic. Thank you. That's for sure.
Yeah. The coming wasn't too bad. It was more like on the I-80 that actually started getting a little like, ugh. Well, good thing I came early. But so I'm not against pets. It's just not a responsibility I want to take. I want to always make sure that I clear that up, because everybody's like, you don't have pets. You probably hate pets. I don't. My sister has a dog, and his name's Finley, and I love him so much, but because he lives with her.
Yeah. Well, and you got to respect, like, some people, they take animals and pets, and they don't. It's a big responsibility.
Yeah.
And if you're going to have an animal, you want to really take care of them, Dave, and not let them go running around the neighborhood over and over
Jeez
again.
Louise,
Is
man.
it lady,
I
right?
didn't know that there was a can of worms here, but
Pets are a pain in the butt. That's what they are.
One day, Dave called me. He's like, lady got out. He's like, I'm having to chase her down the street. It's like the 3rd time.
Pissed. I was pissed.
yeah, other than that, simple life, to be honest with you. I love yard working. I know that sounds so weird, but
No.
pulling weeds is
Yes.
my going to the store. for
Gardening
really
is so, like, it's such good self-care, actually.
Yes, yeah, it really feels nice. And right now we're actually working on our backyard for like the 5th year. When you let a project kind of go and then it just goes out of control, you're like next year, and you try a little next year and then you just don't have the time. So right now we have finally 0 weeds in the backyard.
So I'm going to be vulnerable and admit something. So there's no judgment from me, because I have not put the Christmas stuff away. I'm not kidding you. It has been such a crazy year with all these nonprofits and projects.
Do you know how much respect I just lost for you?
Oh.
So Lily and I literally were talking. I'm like, kiddo, if we don't put this away the next few weeks, we're getting to the point of no return. We're just going to keep it up for next year.
What is that? It was Jack's. They changed the name, and I can't remember. The one over here where the old Sizzler was.
Oh, yeah.
So they call it Jack's now.
Jack's.
They changed the name. It's same people. They have a Christmas tree. They just leave up year round, and
That's awesome.
they just change out the stuff. So for Easter, it becomes an Easter tree, and for
But I'd have to take down all the
you go.
ornaments.
Oh yeah,
Forget
he
about it.
hasn't gotten there
I might as
yet.
well just take the whole thing down.
take the whole thing down. Okay.
Put a blanket over it.
That's right.
Yeah, it's a workout machine I don't use.
Oh, that's too funny.
Yeah, but I do put away my Christmas tree, but sometimes I'm not.
Don't judge me. Like, don't judge me.
No, I wasn't judging. What I was gonna say, addition to,
Dude, you
was
knew I
that-
would judge you.
I know.
Well, sometimes I don't even put it up, but not in a bad way, because I'm like, sometimes we don't even spend Christmas at my house, so I'm like,
You terrible person. Who doesn't put up a Christmas tree?
Actually, Lily and I sometimes we take a break, and no judgment to any other faiths, but for us as Christians, sometimes it's important for us, and we do it maybe once every 4 or 5 years, just to focus on what Christmas really matters, and we don't do a bunch of the decorations and not a large amount of presents. We just enjoy Christmas and family.
yeah.
So I think there's some.
Piggyback
You're
on
lying.
I'm not lying. Absolutely.
You're lying.
I am not lying. Absolutely.
Liar.
Hallelujah.
Liar.
I am not. Absolutely.
I'll ask Lily.
Okay.
We'll
We'll do
confirm it later.
We'll do it right after.
I like what
Right
you said
after
about
us.
the low expense, no
Yeah.
Christmas gifts, because we are really, really about that. I feel like a lot of people forgot that it's not about the presents, how many you get, how much you spend on somebody. It's
is.
about
It's about the presents.
Not that. And think about those families that can't afford to do that, and what their children seriously, or the parents feel like that's
That's
not
what-
about
Hey, what
that.
I feel like when I have a lot of nephews and nieces, and I'm
I
like,
know.
oh, you
Hey,
my
that's Five Below is a magical place.
well, yeah, that's true. I have
Oh, that's where you
$5
got my
gifts.
gifts.
Not yours. I go to the Dollar Tree.
yeah. You know what we do tell our individuals? We say, you don't worry about giving gifts to our kids, and we won't worry about giving gifts to your kids.
I like
We
that.
just worry about your own kids, and we worry about ours.
Dude,
Except for Stevie, I want to buy him just the
Nika-
loudest toy.
my wife's love language is gifts.
Oh, yeah.
She loves gifts. So now it doesn't have to be an expensive gift. It can just be like, a card I made her,
Do you go to the dollar store?
and then I go to the dollar store and get the necklace that makes her neck green, all that fun stuff.
That's awesome.
bunch of snacks.
Yes,
No.
they have good snacks.
No, she's awesome. I love my wife, and she's her love language is gifts, and it's important to know how we feel appreciated and cared for.
Yeah, that's it.
And I think for some people, it's okay to be like, hey, Christmas this year, let's just not do gifts. My wife would literally go crazy if we said, because that's her love language.
Great, she'll hate me more than she already does. That's what I said. That's great.
So, Jessica,
Yeah.
do you have anything else you wanted to add, somewhere that people can find you, support you, what you guys are doing with Access to Healthcare?
Well, we definitely have our Facebook page, Access to Healthcare Network. I know we have a Instagram. Okay, another thing about me, I don't have any social media, so I don't deal with that part of it. Our marketing, beautiful Beatrice does. So we also have just a regular website, accesstohealthcare.org. You can follow us. You can find out about updates, where we're going to be in the community. So I'm actually in charge of our calendar. And so we do have a Google Calendar, and then we do have our just webpage that'll advertise where we're going to be at in the community. So if you know somebody and you're like, you know what, let me send that person to any of the resources, again, discount program, women's health, and so breast and cervical care, transportation, anything that they need, have them go over to those events, or they can visit us at 4001 South Virginia Street, Suite F like Frank. We're above the library at the Reno Town Mall. It used to be called the Old Town Mall, for anybody that knows that name, but it's now the Reno Town Mall on Peckham in Virginia. Second floor, we're there Monday through Friday from 8 a.m. to the front office closes at 5. So, but some of the representatives that have the services, they leave a little bit early, but you could always stop by, and they can always send a message, an email, hey, somebody stopped by, if you can call them tomorrow, or whatever the case may be.
Awesome.
Yeah.
Thank you so much, Chaz. Do you have a
Yes.
final thought today?
I have a question.
Yeah.
So something that a lot of people don't realize, especially for those who are disabled. My mom is physically disabled, and she is moving back from another state. I was shocked at the process for them to cancel their Medicaid and switch everything over to the new state. It's a pretty big ordeal.
Oh, yeah.
So is that something, I see here it says food stamps and Medicaid application. How does someone go about utilizing that?
Yes. So with our Nevada Care Connection program, we have representatives that would check in to see what's going on. A lot of from one state to the other, as you know, they have different little rules and things like that. But they could always contact the individual and find out if there's something we can do on our side to get that canceled, to get it all squared away. We can do that, or even the transfer if there is such thing. I'm not familiar with how they do it because I'm not one of those representatives, but yeah, they can always give us a call. Our 877-385-2345 number is our resource line. You can definitely call there and just tell us your need. That's what I always like to tell everybody. Tell us your need, because some people call and they're like, well, I call this number because they told me to call, and well, what is it that you need? We also screen for other services. So for that specific situation, hey, I'm moving out of state. I want to know how to cancel my Medicaid or how to transfer it. What do I do? And then we can guide them from there.
Okay, and is that just for members, or that's a general?
No, it just anybody, and that would make them a member of one of our services, which would
Oh.
be the Nevada Care Connection program. Okay. Yeah, because you don't have to be part of one or the other. You could be on the discount program and another program, or just one or the other. So yeah,
that's a great benefit. Thank you.
For sure, absolutely.
Awesome. Well, you know what? All good things must come to an end, just like this episode. Yeah. And this was okay. Maybe it wasn't good. It's not your fault.
It's totally great.
Yeah,
my fault. I was gonna point it at you, but I was like, that was kind of mean. That's a little deep.
I thought it was great. Even you, I thought you did great.
Oh, wow, make me feel bad now.
Good.
Thanks, buddy. That was your goal.
That was my goal, yeah.
Hey, if you want to find out more about Good Shepherd's Clothes Closet, please visit getclothes.org. Thank you for being a returning guest, Jessica. We really appreciate it.
Thank you for having me.
If you want to find out more, visit Get Clothes. If you want to donate clothing, you want to donate time, you want to donate financially, we give away all the clothes for free. So we are a nonprofit.
For free? Free.
And so we really need your support any way you can. So please visit getclothes.org and you can donate there, or find out more information just how to get involved in general. Honestly, the biggest supporters we have, some of the biggest supporters are our volunteers. Yes. In so many ways, and financially and physically showing up and making this thing happen.
I really do admire our volunteers. I mean, they give so much out of their hearts, not only financially, but time and just awareness. And we have some volunteers like Joyce that have been here for like 15 years. I mean, I think
it's
really
like
special.
18. Anyways,
that's amazing.
I don't know. It's been a while. And then we have other people too that will literally go and buy men's jeans because they know we need it. So I had one volunteer say, "Hey, I found some in the discount rack. Look what I found, Dave!" And they got so excited. I'm like, "That is so nice of you."
You know who I saw before you wrap it up? I was at the stoplight today and I looked over. I was like, "That guy is a scary looking guy. I wouldn't mess with him." It was Ray. He rolls down the window. He was driving for Napa trucks. I was like, you're volunteer Ray. What's going on, buddy? It's so good to see you.
Wow.
We had a good chuckle.
It's good. It's good. Hey, we help over 800 people a month. No matter what, we're asking you to come alongside and help one. That's right. All right, guys. Thank you so much. We'll see you next week.
Where is that?